Hi everyone, Dr. Campbell here with another Dissecting an ICD-10 PCS Operative Report session. Today, our patient has a full thickness burn to the right. And the procedure that the physician is going to do is a split thickness skin graft from the right thigh to the right foot. So as I always say, it's critical that you understand what's happening, which is the procedure, and why it's happening, which is the diagnosis code. And when I say you need to understand, I mean that you need to research the terms and you also need to get pictures, a visual of what the condition as well as what the procedure looks like. So as you're reading the report, you understand what's going on. For example, in a skin graft, a portion of the skin is taken from one area of the body and placed on another area. This particular portion of the skin is usually taken from the patient, but there are other ways to perform a skin graft, such as with a skin substitute. Now, one of the reasons why knowing that whether or not the skin graft is being taken from the patient's own body is because there's actually a guideline regarding grafts from the patient's own body. This is known as an autograft. Guideline B6.4 says, if, as part of a procedure, an autograft is obtained from a different body part, a separate procedure is coded. So let's take a look at our patient. So here we have a 33-year-old female who suffered a full thickness burn to his right foot. The patient has a history of cardiac disease and hypertension. The patient is a 40-pack-a-year smoker who quit 10 years ago. And today the patient presents for elective debridement of a wound and split thickness skin graft. So as per usual, the patient was taken to the OR, placed in the appropriate position on the operating room table. Adequate IV sedation was provided. The right lower extremity was prepped and draped in the sterile fashion. Sharp debridement of the ulcer was carried out, and the ulcer was approximately 4.5 centimeters in the area in the lateral dorsum of the right foot. So we know from reading earlier that this problem is on the right foot, right? We see this over and over and over again, okay? That's where the patient's problem was occurring. So debridement was carried down to viable tissue, and then a 4 by 5 centimeter split thickness skin graft was harvested from the upper aspect of the right thigh. Let's pause for station identification. What did that guideline say? Guideline B6.4. If as part of a procedure, an autograft is obtained from a different body part, a separate procedure is going to be coded. Guys, if you have not done so, listen to my ICD-10 PCS guidelines review session, because that's going to prove to be very valuable in your journey into ICD-10 PCS. All right, so we got the harvest from the upper aspect of the right thigh. Well, we know the patient's problem is on the foot, so this was definitely, and let's write this word down here so you won't forget it. This is an autograft, okay? Let's see, did I spell autograft correct? Yeah, that looks correct. All right, so as we continue through the report, so you may be wondering, well, what do we do with this? How is this coded? Well, essentially what they did was just take out a little piece, right? So what's the root operation for that? Taking out part of a body part. So it's an excision. And it was an excision of the skin. And where? Remember they said it was the upper aspect of the right thigh. So it was excision, it was skin, and it's the right thigh. So that's actually the upper leg, and it was the right side. All right, so then as we continue to read through the report, the graft was then meshed and applied to the right foot. Let's pause for station identification. Remember I said earlier, a graft is when a portion of the skin is taken from one area of the body and then it's placed on another area. So we're seeing that that's what they actually do. So then guys, after that, the graft was secured with some sutures. They stopped the bleeding, the sponge count was correct, and then the procedure was over. So now that the procedure is over, we have to code it. So we know we have to code this excision, but we also are going to code the skin grafting procedure itself. And this is actually coded as replacement, right? Because they're replacing the patient's own skin with some of the patient's, replacing the patient's skin essentially. Okay, and that was on the skin, right? And remember it was on the foot where the procedure was performed. So since we just talked about replacement, let's take out our ICD-10 PCS manuals and we're going to look for replacement first. So we always begin where the term actually starts, okay? We always want to begin there. So in this particular case, we're talking about replacement, right? And so now what we are going to need to do is to locate skin. So I'm looking, remember, don't forget, first grade line, second grade line, and I'm looking for skin, and guess what, guys? I found it. So, skin, and skin of what? Yes, foot, and which foot? Right foot. So, as you know, we'll write down what table we'll need to go to. And in this case, it's table 0HR. 0HR. And then that fourth character, guys, that's the body part. But remember, our tables are built on 3 characters. So now I'm looking for 0HR. Okay, and I have found it. And okay, so now notice, the one thing I want you to notice is that there's a lot going on with this table. So you have to pay very close attention to the details. So we know table 0HR. Let's make sure you can see that. 0HR, okay. The body part was a M, which is the skin of the right foot. Right foot, right? And then notice that a couple of things, guys. I want you to notice something. This is where that attention to detail is going to come. So notice skin, right foot is here with a character value of M. Skin is also in this row. Remember, coding guidelines state when you're going to build your code, you're going to build it from left to right, and you can't like crisscross up and down. So you have to decide which row are you going to be in. Both of these say external, so that's the same. But here you notice autologous. Ours was autologous. How do we know? Autograph. Remember I wrote that earlier? So 7. And then the question that you have to answer was this full thickness or partial thickness. So our final code is 0HRMX74. So that's the first code. Remember, we still have to code the excision for the harvest, because remember, guideline B64 says we can do so. So we're going to go back to the index and we're going to locate excision, and this is excision skin. Okay. And what part of the skin did the harvest come from? Remember, we wrote this down earlier. Excision, skin, upper leg, right. Okay, so then we're at skin. And then what are we going to look for? Upper leg, yes. Let's make sure you guys can see that. Upper leg. And then look at what we have here. 0 HB HXZ. Let's write that down. Now you may be wondering, do we have to look up that code when the index actually gave us the entire code? And the answer is yes. You must always, per guidelines, you must always verify the code in the alphabetical index. And so we're looking for table 0HB. This is when you get to learn if you know your alphabet. So 0HB. Okay. 0HB. And then remember we wrote down H, which is, make sure you guys can see that, skin, right upper leg, external, no device, no qualifier. This was not for diagnostic purposes. This was a harvest. All right, guys, thank you so much for listening, and see you real soon.